Good morning, I'm Erica Vitrini. Advancements in technology have given us access to more options than ever before, including ways to address many of the health issues we face today. We're covering dealing with unwelcome side effects from cancer treatments, ways to decrease scarring from surgery, and an inside look at a better night's sleep. Access Health starts now. The growing field of laparoscopic surgery, commonly referred to as minimally invasive surgery or MIS, is advancing healthcare for patients by providing doctors new tools to accomplish the same goals as they would with traditional open surgery. Access Health caught up with Dr. Stephen McCarris, who is a nationally known leader in the practice of minimally invasive gynecological surgery.
A minimally invasive surgery is something we offer almost all our patients, and it's a surgical technique that is less invasive, meaning it requires small incisions, usually about the size of a dime, one through the belly button or umbilicus, where a camera is placed so you can look inside the abdominal pelvic cavity, and then usually on the lower left and lower right side of the abdominal wall, an incision either a dime size or quarter size is made where you can pass instruments and what we call trocars to get access into the abdominal cavity. And those instruments are actually held by the gynecological surgeon, and it's an extension of the surgical hands.
Laparoscopic surgery can be used for various procedures in lieu of traditional open surgery, which typically involves longer incisions.
The exciting part of what we're able to offer patients now is not limited to gynecology. In general surgery for gallbladders, appendectomies, adhesions, and bowel work, bariatric surgery has had made unbelievable strides in minimally invasive surgery.
The benefits of minimally invasive surgery are multifaceted compared to open surgery, such as shorter hospital stays, as well as a reduction in costs. And what does this mean for patient outcomes?
Laparoscopic surgery lends itself to less post-surgical complications compared to when you do an open procedure. A large incision means a longer recovery, increased risk of infection or bleeding or scarring. If there's less injury, there's quicker healing. There's shorter hospital stays. There's getting the patient back to her life and her normal routine sooner.
Scars may mean bragging rights for a few men, but for most patients and the almost 600,000 women per year that are having hysterectomies in the United States, small scars mean good news.
I still go to the beach. I'm a beach bum. I love going to the beach with my daughter. I don't wear a bikini, but if I wanted to, I don't want a big scar. There's new technology now that can allow us to have a surgery and not have to have that big scar. It was a nice option to know that the surgery could still be done just as well, just as effective, with very little incisions.
I noticed that my periods were extremely heavy, very irregular, painful, and really interfered with my daily activities and my life and all of the activities that I needed to do at the time. There was absolutely no way I could be down for 6 weeks. With my kids at that time, they were, 4, 9, and 11. Dr. McCarris at that point suggested there was a less invasive technique, a minimally invasive surgery.
Developments in instruments, imaging, and surgical techniques have improved the outcomes and feasibility of laparoscopic surgical procedures. Percutaneous laparoscopy is a new category of minimally invasive surgery that requires smaller instruments than traditional laparoscopy and leaves nearly unnoticeable scars. How are they doing this? We enlisted the help of Dr. James Dana Condrup, a minimally invasive gynecology specialist, to explain.
From the point of view as a surgeon, what we're doing is we're doing the same techniques, we're doing the same type of surgery that's been proven over time, we're just using different instruments to do that surgery. So now we're using instruments that are much smaller, they're versatile, they're very easy to use, but the nice thing about the percutaneous instruments, the mini-lap and the Percuvance, they're very versatile, even in difficult surgeries that are very challenging to the surgeon, they're still applicable in that situation also. The mini-lap can be inserted directly through the abdominal wall, right through the skin. When I use the Percuvance system, all I have to do is take a small needle, pass the needle through, and then pass the percuvance instrument through the abdominal wall.
Companies such as Teleflex are dedicated to improving the patient experience by making MIS even less invasive by combining access and instrumentation, making the incision even smaller.
So for a lot of women, minimally invasive surgery which you have less invasive techniques, is very important to them because they're very concerned about their scars. When it heals, it looks just like a little mole or a freckle, really, really tiny. So the benefit is to the patient from seeing tiny little incisions or not seeing the incision at all. Also, you have less trauma to the abdominal wall when you use these very small percutaneous incisions and very small percutaneous instruments.
When surgery is needed, women need to be educated about what are the associated complications to their particular surgery. That information is available. We encourage women to get involved and be part of the strategy and what they want out of these types of operations, and to actually vet their surgeon that's going to do the best job. That's really what the message is. Find the surgeon that you know is an experienced expert surgeon and the technique that you need.
The tools and techniques for minimally invasive surgery are constantly evolving, and one priority is always in the forefront: what's best for the patient. I'd like to thank our patients and doctors for all of the information on minimally invasive surgery. For more information on the Percuvance percutaneous surgical system, visit teleflex.com. And of course, you can find all of these resources by logging onto our website at accesshealth.tv. Don't forget to follow us on Facebook and Twitter. The death rate from cancer has declined steadily over the past 20 years, due in part to advances in early detection and innovations in treatment options. However, the fact remains that patients can be left having to manage a variety of troubling side effects and complications. One such side effect, oral mucositis, is reported to be one of the most debilitating. Up next, an innovative solution in support of cancer care.
I was diagnosed with early onset anal cancer. My treatment was the same whether it was stage 1 or stage 4. I had radiation and chemo. So one of the side effects I had heard about was mucositis. My mouth was kind of irritated and red and inflamed, and I thought, well, that must be what they mean by mucositis. But the next day I woke up, I had these sores like all over my mouth, and I thought, oh my God, this is unbearable. I never had anything that was that painful in my life. It stops you from being able to function or have a normal activity level. It's just excruciating pain. I started to look for some kind of solution so that I could maintain and just have a level that was bearable. And that's how I found Gelclair.
According to the American Cancer Society, approximately 1.7 million Americans will be diagnosed with cancer this year. And for the majority of patients receiving chemotherapy or radiation treatments, this can mean having to cope with a variety of debilitating side effects. One of the most commonly seen complications of cancer treatments, oral mucositis, can have a significant effect on patients' quality of life. So joining me today to discuss the supportive care solution is Deborah Gordon and Annette Quinn, Program Manager of Radiation Oncology at the University of Pittsburgh Cancer Center. Thank you both for joining me, ladies.
Thank you.
Annette, let's start with you. Can you tell us a little bit more about oral mucositis and who exactly it affects?
Oral mucositis is an incredibly painful inflammation of the lining of the inside of your mouth. It starts out as redness and swelling, and then it quickly progresses to open areas, sores, ulcers throughout the mouth. It's sort of like a bad sunburn inside your mouth. It can be incredibly painful. It affects patients undergoing head and neck radiation therapy, and also affects patients that are receiving certain chemotherapies for certain types of cancers.
And it's painful.
It's incredibly painful, Erica. These patients get to the point where there's so many sores and lesions in their mouth that it makes it very difficult for them to eat.
Right. So not only are you battling this pain, but then you're not eating. I'm assuming you're not resting much?
Right. Nutrition is important when it comes to cancer therapy. We know that we're not only affecting the bad cells, but we're also affecting the good cells. So we want our patients to have good nutrition to be able to recover from the effects of the cancer therapies. So we need them to be able to eat. And when your mouth is full of these very painful ulcers and sores, it's hard to even swallow your own saliva, let alone try to get food down.
So the pain has a rippling effect, really.
It does, absolutely.
Deborah, I want to talk to you. You battled cancer, and as a result, you had oral mucositis.
I did have it.
Can you tell us in your words, what was that experience like?
I had chemo at the beginning of my treatment, and about a week later, I started to really have sores in my mouth, to the point where it was unbearable. It was really extreme pain. I couldn't sleep. I had to bolster my pillows. I thought I would be able to continue doing my job. I had a lot of appointments. I showed real estate, and I couldn't talk. I couldn't leave the house. I couldn't eat. You had to keep hydrated, so you drink as much liquids as you can to avoid the sores. I had them all over, under my tongue, on top of the roof of my mouth, the hard palate, the soft palate. I didn't know these symptoms would be so extreme. I said, is there something you can please do? I can't handle this pain. I can't continue. Yeah. And she was able to help me out.
This is a very common side effect of cancer therapy, Erica. Oral mucositis is very much underappreciated and undermanaged. It's in the list of things that are going to happen from the cancer therapy, but oral mucositis, a lot of patients aren't exactly sure what that is or how painful it can be. The other point that Deb brings up that is incredibly important, it's so painful to patients that they're not willing to continue sometimes with their cancer therapy treatment, which is a little disheartening because it can be managed.
So Annette, what can we do to help the patient?
Erica, as an oncology nurse, it's my job to educate the patient, first of all, and how severe oral mucositis can be. And there's a couple of things we can talk to them about. One is good oral care. Keeping your mouth, when you have open sores in there, you could be at risk for infection. So keeping your mouth nice and clean, doing rinses to help with salt water to help keep the environment in your mouth nice and clean. The other thing we could do is help with the pain. So letting them know it's very predictable. That's the one good thing about oral mucositis is we can predict with certain chemotherapies exactly who is going to get mucositis. The other thing, Erica, is we have a great product that can help with the pain of oral mucositis, and it's called Gelclair. Gelclair is an oral gel that coats the lining of the inside of the mouth, and it forms a thin barrier over the lesions to help reduce the pain. It sort of covers the nerve endings that are exposed, causing a lot of the pain. By forming that thin barrier, it allows patients, as Deb attests to be able to eat, to be able to continue to talk. So the barrier over them is very protective and helps with the pain.
So Annette, how is it administered?
Gelclair is very suitable for patient use. What you do, you just tear open the packet, and then you're going to squeeze the entire packet into a glass. Very simple. Then you take 1 tablespoon of water, 1 tablespoon, that's it. Stir it around. Then we ask patients to take the solution and swish it in their mouth for a full minute. Sometimes that's hard to do when your mouth is already sore, so I always say to them, do it for as long as you possibly can. The great thing about Gelclair, Erica, is it's alcohol-free and it's a non-numbing agent. One of the most commonly prescribed products out there currently for oral mucositis is a numbing agent. When your mouth is numb, you can't do a lot of things, and one of the risks is that you could re-injure the tissue that you're trying so desperately to heal. Of course, it's contraindicated in any patient that has a known hypersensitivity to any of the ingredients that are in the product, but otherwise it is safe to use.
Deborah, I know you had an opportunity to use Gelclair. How did it affect? Did it give you any relief?
To have something that helps your mouth recover. Anything that can cover that open wound is great. You just want to get rid of that horrible pain.
So Annette, does everybody have access to it?
Yes. Gelclair is distributed by Mitatech Pharma, and it is available as a prescription from your healthcare professional. Mitatech offers a zero copay to patients that are eligible for the Gelclair. And if patients aren't eligible, there is a patient assistance program available.
And so where can we go for more information?
You can go to gelclair.com. There's a lot of information on there, Erica, for both healthcare professionals and for patients as well.
Deborah, thank you so much for coming in and sharing your story. And Annette, what great information. I know there's so many people out there that are listening that are going to benefit from everything we talked about today. If you are undergoing cancer therapy and are experiencing pain from oral mucositis, ask your physician if Gelclair is right for you. As always, you can find the information as well by visiting our website at accesshealth.tv. Experts recommend replacing a mattress every 10 years, and for many, mattress shopping can be an expensive, confusing process. It's a big purchase, and it's where we sleep, so it should be perfect. Well, here to help us master the stress of mattress shopping is Jason Pattison from Zoto Inc. Jason, thank you so much for joining us.
Thank you for having me.
So why is mattress shopping so stressful, and what do we need to know?
Well, buying a mattress is a big decision, not just because of the financial investment, but because it involves your sleep health and your well-being. It's those reasons that most people want to shop around, but with the multitude of brick and mortar mattress stores and all the department stores that offer mattresses for sale, it becomes very cloudy, the differences between each option. Luckily, there's an alternative now. People can shop online in the comfort of their own home and get a department store quality mattress for a fraction of the cost, shipped directly to their doorstep.
But I imagine that, like in retail stores, online there are a ton of options. So how do I choose?
It's all about being an educated consumer, knowing what your needs are, and knowing the quality of the materials that the manufacturers are using to make the different mattresses.
Right, so now the bed mattress is coming to me. I have no opportunity of really feeling it before it arrives.
Even if you spent 15 to 30 minutes in a store laying on one before you purchased it, it's still not enough time. We give the customers 100 nights to try it out.
Wow, 100 nights.
100 nights. So if at any time during that period you decide that it, after all, isn't for you, we'll pick it up at no charge and refund 100% of your money.
A question, comfort level is always sort of a thing in my family. My husband likes it super firm. I like it less firm. Is it difficult to kind of determine or satisfy everybody's needs?
It's true that comfort levels are different, but our needs are surprisingly similar. And because that's what we focused on when we designed our mattress, it's important for the customer to know what's inside the mattress that they're buying. So here we have a cutaway from one of our mattresses and one of our competitors. Each layer is performing a specific function individually and cumulatively. So our top layer is our Thermophase comfort layer. It is designed to cradle your body, give you that hug feel, but it also has an engineered molecule that actively cools or heats the mattress. If it becomes too warm, it will react and cool the sleeping surface, or if it becomes too cold in the room, it'll actually redistribute absorbed heat to keep you warm.
You can feel it cooling.
Below that is our cool flow support layer. It aids in the cooling, but it also provides the pressure point relief that is essential for healthy sleep. The third layer is our transition layer, and it provides localized bounce. So if your partner is sleeping, you could jump into bed without waking them. Additionally, it provides edge support. If you happen to toss and turn in your sleep, you're going to roll right off of a 2-layer bed.
For sure.
But on a 3-layer bed with the transition layer, you're going to get the edge support to keep
Look
you
at
sleeping
that.
soundly on top of the mattress.
Wow, whoa, that's got nothing.
Finally, we use an ultra-dense foam for our base layer, and that just ensures longevity and a good foundation regardless of the type of frame you want to use. On the floor, on a box spring, on a slotted frame, Zoda will work on all of them. So our combination of layers is a patent-pending technology called Z3, and it was designed to be a one-size-fits-all regardless of the size of the user. The more weight you put on it, the more it engages the lower levels and keeps universal comfort and keeps you from sinking through into the foam base layer. So as a heavier sleeper starts to sink into the comfort layer, they engage the second and third layers and get the same level of support that a lightweight sleeper would laying just on the comfort layer. We like to say that whether you're a petite ballerina or a football lineman, you're going to be comfortable on a Zodo.
I love it.
We have a 95% satisfaction rate, so out of 100 mattresses sold, we only see 5 returns.
My question is, foam is chemically based material, so how do I know that this is safe for my family?
A lot of foam is imported from other countries, and you never know what you're going to get. That's why it's important to know that your foam was tested and certified. We pour all of our own foam right here in the US, and we only use CertiPure certified materials, so you can sleep soundly at night knowing that it's safe for the environment and your family.
How do you get a king-size mattress in a box this big?
It's magic.
Just like this?
Well, that's not what I had in mind, but that worked.
Okay, so this is how the mattress arrives at your door, but I'm still not understanding how you get a big mattress into a box this size.
It's cutting-edge packaging technology, and I'm really glad that we have a chance to show your viewers because most people don't believe that you can get a quality mattress into a box this size.
Can we open it up?
Let's do it.
All right.
I'll let you do the honors.
Okay, this is exciting.
So now the first layer of shrink wrap is off, and the mattress will unroll. So we'll pull it to the edge of the bed here.
This is exciting.
It is.
And I'm surprised how quickly it expanded.
Yeah, it's ready to sleep on right out of the box, but it does take about 24 hours to expand to its fully advertised dimensions. But now that the plastic's off, you can actually see our proprietary cover. It's a poly rayon blend, and the best part is it's removable and machine washable.
I've got to sit because I've been looking forward to that. Ooh, it's got some nice bounce.
Yeah, it's not a cheap mattress. In fact, 3 different independent review companies rated us ahead of the top-selling department store brands. Well, I really appreciate the opportunity to share our story with your viewers. And on that note, I'd like to offer a special discount, just Enter the promo code at the bottom of the screen.
Well, who doesn't love that? And to find out more about Zoto Mattress, just visit the website at zotosleep.com. And of course, you can find all of these resources on our website at accesshealth.tv.